So, hello everyone. This is Dr. Vivek Goel, your nephrology faculty at DocTutorials, and I'm very pleased to have with me Dr. Pallavi Dubey, who has scored an immensely awesome rank of an AIIMS merit list rank of rank 4 and a combined merit list rank of 6. So, first of all, first things first, a very big congratulations to you, Pallavi.
Thank you so much, sir.
So, can you just take us through those 5, 10, 15 seconds? I mean, when you came to know the results were out and you were yet to check the results,
Uh,
what exactly happened? Whom
uh,
did you check your results with?
actually,
Just take us through that
uh,
those moments.
yes, sure. I actually happened to be in Delhi at that time. I was just the result actually got very delayed. I was expecting it to come in the morning. It came around 9, and I was very anxious. And my interview actually did not go that well. So I was not expecting an AML rank of 4. Actually, I was expecting a better rank in CML, but somehow the reverse happened. But still, seeing an AML rank of 4 was very surprising, and I got really happy seeing the ranks.
Okay, so we'll come back to the details of the interview thing, which we
Yes,
also
sure.
discussed separately. But first, introduce yourself. I mean, tell us where did you do your UG and PG from?
So I am originally from Raipur, and I did my UG from BJ Medical College, Ahmedabad, and did my PG from VS Medical College in Ahmedabad only. I was a 2012 batch, then 2018, and I gave INI for the first time in this attempt.
Wow. So this again, to all the young listeners or to all those people who are pursuing their MD and DNBs currently, this is a lesson that you can take from Dr. Pallavi that, as everyone has already said, that your first attempt is the best attempt because, and Dr. Pallavi has also proven it once again. So Pallavi, how do you feel actually? Tell us this first. I mean, having scored this
About
rank, you've already told that, yeah, I mean, were you specifically preparing for it, or it just the exam came by your way and you took the exam? I mean,
no, I was actually specifically preparing for the INI exam, and I got very happy with this rank. The only problem was that I wish we had the seats also, but that's hard luck. I actually I was interested in nephro since my second year after the postings, but I really got serious after my MD exams. So what I saw few of my colleagues clear these exams, and then I really got motivated that these can be done. And in January, I think after the NEET 2021 session, I did not get a good rank in nephro that time. That was the moment I decided that I really want to crack a central exam, and I started preparing for it specifically. And I think that is what helped me, because I don't think these exams can be cracked by not being too focused on them. So you need to have a very targeted approach and that mindset to clear these exams. So I was entirely focused on the INA itself.
why in the first place did you opt for nephrology? I mean, what in nephrology attracts you that you've decided to
Uh,
marry it for the rest of your life?
I think nephrology, it's like mathematics. It's very logical. At least what I have seen reading those ABJs in our hospitals, I used to love doing that. The fluid management and the electrolytes. It's like you have to be on your toes all the time, and you need to have very quick reflexes. You cannot take hours to take a decision. So I thought that I have it in me, although I did not do that well in my PG, but I thought I would love doing that for the rest of my life, and I would not get bored of it. That was one of the major reasons to
Yeah.
go ahead with it.
And to add to what Dr. Pallavi said, most of us, even me, what I have unanimously seen across nephrologists is that, nephrologists are basically internists at heart. And I feel
Yes,
the super specialty which is closest to internal medicine is probably nephrology.
yes,
Because, you
definitely.
get to see
Hmm.
autoimmune diseases, you get to see infections more so in nephrological patients than so even in otherwise. And you get to see every cohort of patient. And as she said, there's electrolytemia and everything. So absolutely well said in that front. So I mean, when did you decide? I mean, in your timeline of your PG residency that you would be targeting nephrology during which year?
My second year,
Second year.
I used to like nephrology since first year. Actually, my thesis was also on nephrology itself. So I remember I had entered the college, and my mentor, she had asked which subject do you like, and I had just reflexly said nephrology. But gradually I started developing a liking to it, and in the end of second year, I was sure that I would go ahead with nephrology.
Okay. So, to inform all the viewers also, Dr. Pallavi was a student with DocTutorials and she was a subscriber of the INISS test series for nephrology. And she was a regular performer in all the tests. after reviewing her results, more so after the exam, I got to know that she really did consistently well. So, Pallavi, I mean, to all the young viewers, to all the young students of who are currently pursuing their MD and DMB medicine, and who want to be a topper like you in the Central Institute, especially for nephrology, what would be your advice to them? And how would you say that Doc Tutorials has helped you achieve your dream?
My first advice would be to make a conscious decision that whether like we have different patterns now for NEET and INI. So to make a conscious decision that you want to pursue for an INI exam or for the NEET, because I think it is a bit difficult to crack both the exams with wonderful ranks. And if you're very sure about INI, then you should start studying, because in NEET you don't need to study fee heavily as of now. And for nephrology, like I gave the paper, you definitely need to study fee heavily. It cannot be done on the basis of Harrison alone. So Fee Haley, end to end, I think it's a very great book, and it is a very interesting book. It makes nephrology seem easy actually. So that was one thing that I did. And doc tutorials, they have two sets of, like, one there is a question bank and the other is the light test series. So I think in the when you have just started studying nephrology and you don't know how the subject is, how the questions are, the first thing that I did was solve all the question bank. They actually had easier questions, but they brush you up very nicely. Like, yeah, I think I avoided silly mistakes because of the I solved the entire question bank of nephrology. So very basic questions. They'll just start your mind. And once you think, after a month or two, when you are confident, that I was confident that I am on a basic level for nephrology, then I started with the elite test series. And that those elite tests are absolutely wonderful. I think most of my credit, I feel it was one thing, and the elite test series was the other thing, which made me up to the mark. The questions that Sir has formed, they challenge your mind. Very less factual questions, like the both the INI test that I gave for doc tutorials, the INI paper was almost similar. I thought I was giving a doc tutorial test only. So that was a wonderful experience. I did not think anything coming out of the box. The questions were conceptual, which were in all the tests. So I think definitely you should go for the light test series. They have wonderful questions, and sir, you have actually taken up a lot of time for those questions, and those are amazing.
Yeah, actually, I have got this review time and again from each topper student of ours,
Hmm.
because those students are actually curated by me. And I mean, they
Hmm.
have not been picked up from any source that I can challenge you. They have been
Hmm.
made by me, and they are being made by me each day. Each day when I'm reading anything in nephrology,
Hmm.
anything I come across conceptual or new, or that needs to be asked, or which is important, I formulate that question then and there and put it in my notes. And
Okay.
then when the
Uh,
time comes to, I mean, to give a question paper, and then I extract out of my box. So that is why
okay.
I do
Hmm.
know that these questions are, and I try to inculcate a lot of things in one question.
Hmm.
One question is not that, because I include a match the following. In one match the following, I
Yes.
include a lot of drugs. I include a lot of concepts,
Hmm.
so that if you solve 60 questions of that test, you are
Hmm.
actually getting a lot many concepts.
Definitely. What I did was that every question that was there were the elite test of the normal text 60 questions ones, and we had two INI tests also. So what I did was every question that you had asked, I always went one step ahead and read the topic in itself, because I thought that those were the very important areas from which questions could come. And actually, questions did come from those topics. So while solving the paper, I was actually very excited that, okay, I know this, I know this. I mean, it did not feel unfamiliar. The paper was very familiar because I had seen similar pattern of questions in the elite test. So that was a huge advantage.
So, that's really heartening to hear that from you. You being
Yes,
a
sir.
topper, and if you are absolutely, validating the credibility of the questions that I have set, and we have cumulatively set up at Doc Tutorials, it gives us really immense happiness. Now, as you were talking about the pattern of INISS. So, for all
Yes,
the
sir.
viewers who might not be that aware of the pattern, NEET
Hmm.
SS, it's fine. Most of us now know that it's most broad specialty based. So,
Hmm.
can you just tell in brief about the pattern of the INISS, so that any
Yes.
young viewer who would be watching you gets to know about the pattern?
The pattern for INISS is 80 questions, and you get 90 minutes to solve those questions. And I don't remember clearly how many questions were there of nephro and how many of general, because the questions are mixed. And I just cannot recollect what was the demarcation, but I think 60 to 65 questions of nephrology and around 15 to 20 questions of general medicine were there. From what I recollect, almost all the questions were factual or conceptual. There were only two questions which were factual actually, and I had absolutely no idea about them. So I decided to leave those questions. Other than that, the paper really checks your concepts, and one other thing is the ability to solve questions. Like there were a few questions which I was not fully confident, but because I had solved a lot of questions, I could still make a correct. I could conclude the answer very easily because of solving the test.
By
So
eliminating others. Yeah.
yes, yes, yes. So it is, if you have a good basis, a good conceptual mind, then definitely I think this exam is you can crack these exams.
Great. And was there any negative marking?
Yes, it was +1 and -1/3. So
Yeah.
I actually did not go with a planned image that how many I have to solve, how many I have to leave. But I think after giving the exam, I realized that yes, you need to attempt a lot of questions because this paper was a slight easier than compared to the November session. So yes, you had to attempt a lot of questions in this paper. We did not have the option to leave questions. So
Yeah. Actually, all the toppers have, unanimously and consistently told me, because, when I keep asking them how much did they attempt to all the toppers, and most of them
hmm,
attempt, the magical number is somewhere between 70 to 75, because I
hmm.
think, to be in the game, you need to play the entire 50 overs.
Yes,
You
yes,
cannot,
definitely.
bat well for 30 overs and leave the rest 20 overs.
Yes, yes,
So you have to attempt more.
yes,
And
sir.
some questions are, of course, there would be 5 to 10 questions which you may not have heard of, but still
Hmm.
some questions you have to exclude certain options, and if you can, boil down to two options, you still have to mark them.
Yes, yes,
So that's also correct. So as you said, after you gave this written exam and then you qualified, and then there was a second round,
yes, sir.
which was the interview round.
Hmm.
So, I mean, because we were there with you for the interview as well. So just
Yes, sir.
tell the viewers, I mean, how did you prepare for the interview? And did you get any help from the live interview session that I had conducted?
Yes, sir. Actually, to be very frank, I suck at interviews. I absolutely, all my PG Vivas, I have been so terrible at them. I always did good in theory and I always messed up the interviews. Somehow I had those cold feet in the interview. So I was very hesitant before the interview because I did not think I had it in me to answer those interviews properly. But those two sessions, I think we did 3 to 4 hours per session of the
Yeah,
interview
yeah,
with
yeah.
you, sir. And those were amazing, absolutely amazing. And I don't know if you remember or not, when we started the session, the first few questions, I always messed up. I just could not answer. I remember there was this ECG of hyperkalemia, which you had asked me, and I messed up the ECG. I could not even calculate the rate. But I always get that cold feet. But after 4 hours of just talking to you and you constantly brainstorming us, I got that confidence that I'll be able to do it. And the other thing was your interview that you conducted and the AIIMS interview that I had, it was almost the same thing. Like there were questions which you had said that they would be asking, and they actually did ask me, like emphysematous pyelonephritis grading. Then you had informed me about the CT imaging thing you had told. Those exact questions were there. So that was a very great thing. And my first question was on emphysematous pyelonephritis, which you had said that do study the grading. And from there itself, I got the confidence that I'll be able to do it well. So those were very good sessions. And anybody I think who reaches this stage too, I would definitely recommend listening to you, just being in their session. If even if you think that you won't be able to do the interview, just staying in those session with you for 4 hours, that gives you the confidence. And I don't know, I was not confident, but you kept on saying that you are doing great, you're doing great, and that just gave me the whole confidence that I'll be able to do it.
So what were you saying?
We were discussing about the interview, and
Yeah.
okay, so I think those four hour sessions, 2 sessions with you, those were absolutely amazing. And the actual viva was almost similar to it. Like you had given some very small tips how to answer the questions and what they were expecting, like not to jump to conclusions directly and just read your way through the questions. These are small things that nobody would know. I had no idea how to give an interview. So you were amazing, sir, in those interview sessions. And I think there were three of us who attended the interview, and all three of us would be saying the same thing, that Our interview success definitely goes to you, sir. I could not have done it any other way.
Thank you so very much.
Yes,
You
sir.
said that you have cold feet in interviews, and see, you got a
Yes,
better
sir.
rank in AIIMS than the combined
Yes,
list.
sir.
So I did have a
uh,
lot of faith in you. I
yes,
do know
sir.
that, you get to know that, yeah, this person has the concept and the knowledge, but yeah, there's
Hmm.
some problem in the answering. But I
Yes,
do
sir.
know that the experienced examiners of AIIMS would be able to see through the
Yes, sir. But
initial stress and
uh,
stuff.
I am actually terrible at vivas. Like I always mess up the vivas. So I'm always like I get a good in theory and very poor marks in the vivas. So I was not at all confident that I'll be able to do the same interview. So you
So
really
I'm
guided
happy
me
I've
with
been able to
that.
reverse that.
Yes, yes, definitely, definitely, sir.
Superb, superb. Because
Yeah.
whatever the inputs I've been getting from in the past from all the toppers who have
Mhm.
successfully cleared the interviews, I have assimilated all that information and experience, and I'm trying to pass it on subsequently to my students and to
Yes, sir.
those who have been able to reach to that level. So
Yes, sir.
it was a great performance by you. So
Thank you
Pallavi, to
so much,
sum it
sir.
up all, I mean, how would you? What would be your message to any student who is, say, studying in a peripheral medical college and doing his MD or DNB medicine? First of all, is it possible for him to crack a central institute like AIIMS, or does one need to be from Mars to crack such an exam?
I think when I was in my PG, I had this image that the AIMS toppers, they are people who are out of this world,
That's
and
why I
I
asked
am
you. That's
actually,
why I asked
yes,
you.
yes, and I am actually not one of them. Truly speaking, my 3 years of residency, I was not the topper, or I did not do that well in my MD days. But once I thought that I have to do this exam, the first thing that I want to convey for the Central Institute is concepts. They are not going to ask you factual questions. They're not going to ask you percentages or data which nobody knows. There might be some questions, but then nobody would actually know that data. So that
That won't
doesn't
make the
count at
difference.
all.
Yeah,
That won't
yeah.
make the difference at all. But you need to have your concepts very strong. You cannot be behind on that, because even these questions, like I think if I had solved just one more question right, I would be rank 3 or rank 4 maybe. So that makes a huge difference. So where every question counts, you need to be conceptually very strong. And the other thing is MCQ solving, because once you know the concepts, you need to train your brain to apply those concepts. Like when I had just read Fee Haley, I did not do well in the test earlier because my brain was not trained enough to do those MCQs. But after giving the INI test, after solving the light question series, my brain, it becomes like a reflex to your brain. Just you see a question and you just know ki what are they focusing on, what are they asking, and you cannot afford silly mistakes in these exams. I have done a very stupid mistake, and I till date I regret doing that mistake. So silly mistakes, you have to be on the top of your game. You cannot afford to do even one question wrong in a silly mistake. So I think that's it. Fee Haley and solving lots and lots of conceptual MCQs, because solving those question banks, like when I had just started, few of my seniors had suggested those previous year, these big books which have a lot of questions to go through them. But I think that's absolute waste. They don't challenge your brain at all. You need good formulated questions that is going to train your brain in the right direction. Otherwise, it's not going to help at all. You'll just put in a lot of hours and the results won't come. So I think SIR's MCQs are definitely a way which will shape your mind. And then you will be able to, the time taken to solve every single question in INI would be less than if you had not trained your brain that way. So definitely solving questions and giving a lot of tests.
Superb. So what she has, very simply told you that you need not be a superhuman. You need not be from planet Mars. Anyone who aspires to crack a central institute and has the will to put in the dedication and hard work and, formulate a strategic planning towards it, he can do it very simply. You just need to be smart in your study plan and you need to work towards it. As she said, that she studied a good textbook and she went through lots of MCQs so that those concepts no longer become a cortical reflex, they become a spinal reflex. And you get those things on your fingertips. To add to what she said, I would also like to say that, I have made a video module at DocTutorials app, and I have put in 60-70 hours of the entire nephrology has been, what to say, concise in a very very good, crisp and tabular format. So any student who studies that, he need not even study the textbook. That I can assure you. I have put in the latest guidelines. I have put, because there are a lot of redundant information even in textbooks, because obviously they were written 4 or 5 years back, and KDIGO updates its
Hmm.
guidelines each year. So if for example, glomerular diseases, the chapter which is of utmost important in nephrology, the treatment guidelines of those textbooks have become redundant because they have evolved at least twice or thrice after the book has been written. But in my videos, you will get that even. So if you do that, then you always have an edge. So that's great, Pallavi. A big congratulations once again.
Thank you so
And
much,
now,
sir.
what is your plan? Everybody would be inching to know, especially the rankers who are below you. I mean, what do you
Uh,
intend to do?
Sir, we are in a bit of, I think all the people who got nephrology except the top two, they would be in the same dilemma right now to take up the peripheral aims or not, because we don't have the AIIMS Delhi or the Chipmunk seats this time. So I am also actually figuring that out. And at the same time, I'm also thinking to, I actually did not see your videos because I thought I had less time. I started in Jan. So I did not have a lot of time. So I did not do the videos. So in one thought, I am also thinking of to go ahead for the November INI also to give a fair attempt again. So I would definitely like to go through the videos and make myself better and then appear for the exam again. That is one school of thought that I'm having.
Okay. So, you are still trying to figure it out. So, because it is,
Yes,
it
sir.
is a very big decision.
Yes,
So
sir.
it's apt that you think over it very carefully.
Yes,
And
sir.
then, of course, whatever decision you make, I'm pretty sure either which way, you will do great in
Hmm.
life.
Yes, sir. Thank
And
you so much.
I hope to see you become a very great nephrologist and
Yes,
keep
sir.
soaring the flag of nephrology high. And now we shall become colleagues and we shall probably meet in conferences.
Yes,
So
definitely, sir. I would love to meet you.
anytime come over to Delhi, I'm always there.
Definitely,
And
sir.
thank you so very much. It was a pleasure talking to you.
Thank you once again, sir. Thank you so much.
Thank you so much.
Okay.